Hospitals around the country are preparing for Ebola patients. So what are hospitals ready to do, and what can patients expect? Let me show you. At Mount Sinai, all a patient would have to do is walk in and say, I have a fever. And Dr. Shearer from Mount Sinai tells us that that begins the entire process.
Right. So at that point, the staff member would go through a series of questions in our algorithm.
Some of the questions are basic and on signs that just went up on the wall, like, did you travel internationally? And do you have symptoms like cough, vomiting, or diarrhea?
Security would keep the hallway secure from any other patients and staff so that we could move you, the patient, safely down the hallway to where we've identified a secure space.
So no touching anything?
No touching anything.
Talking to anyone?
Right. And given a different clinical scenario, you could be in a wheelchair, you could be in a stretcher, and if need be,
depending on the conditions of the patient.
Right. And then we would, if that was the case, we'd also then have done a bit more suiting up with personal protective equipment.
Here is some of that protective gear: gloves, plastic gowns, face shields.
And a surgical mask you'd wear under that as well. And
that's protecting your face, your eyes, your mouth, your nose,
all
any
mucous
of those
membranes
mucous membranes. All the gear is impermeable, meaning fluids can't pass through. Once the patient is inside the isolation room, that's it. There is no contact with anyone while doctors huddle outside and figure out next steps.
What kind of care you needed, blood to be drawn, and also escalating it to hospital leadership and for the infectious disease department to notify the Department of Health. And most of the care that's involved in treating these patients is supportive care, because as we know, there's no real proven therapy specifically for Ebola at this time. Good hydration, prevention of other infections, diagnosing other infections that may be going on, all that can be done here.
Hospitals around the country have isolation rooms like these ready for possible Ebola patients, but they're hoping they don't have to use them. Rosa Flores, CNN, New York.